what does increase the risk of a woman to this cancer? One is smoking and increased number of sexual partners, and other sexually transmitted diseases like chlamydia, herpes, other infections will increase the chance of human papilloma virus infection. And when there is a decreased immunity, that also causes increase in the incidence of this cervical cancer. And previously, a pregnant woman, if at all she has taken diethyl stilbestrol tablet, that increases the chance of cervical cancer in a baby, but nowadays that drug is banned, so we don't have that risk. Now, other sexually transmitted diseases, HIV for example, it increases 6-fold the chance of getting a cervical cancer or HPV infection. So it is very important that these risk factors should be curtailed to decrease the risk of cervical cancer. Now, what are the symptoms? How a lady can present with, or they know that they have a cervical cancer? The most important thing is postcoital bleeding, that is vaginal bleeding after the intercourse, then we should be alarmed. Or there is a bleeding between 2 periods, or postmenopausal after the cessation of the periods after 1 or 2 years, again she has got a spotting or a bleeding, or foul smelling discharge from the vagina. It can be watery discharge, it can be blood stained discharge. All these are very important. And if it is getting little advanced, then lower pelvic pain, lower abdominal pain will also indicate, and increased frequency of micturition. And sometimes if it is very advanced, then they have a severe pain and they don't have a control over the fecal matter or the urination, that will be very advanced, and having a lower limb or leg swelling. All these are advanced symptoms.